Someone dies of an OD in the US every 5 minutes. 82% involve synthetic opiate. Over 85% of overdoses involve at least one other drug. So what is fentanyl? Much like the fentanyl or not fentanyl that's in my hand, we don't know how much is in there. Like any powder, you can't tell the consistency of something. Take something, you don't actually know how much is in it. That is the problem with street or recreational drug use, and the majority of people having an overdose don't know what is in it either. So in this video we're going to be talking about what is fentanyl, how does it work, what does it do, what do you need to know, and how do we combat this, or how do we help someone who's had a fentanyl overdose. So fentanyl is an opiate, so it's going to be taking away your pain. It's something that we call a downer, meaning that it calms you down, it takes away your pain, it slows your breathing, it drops your blood pressure, all these sort of things. The problem is that if you have too much of it, your breathing will slow until it stops, and your blood pressure can drop until it's too low. And those are the issues with having too much of it. The real other issue with fentanyl is that it is 100 times stronger than morphine and 50 times stronger than heroin. The problem with fentanyl is that you can be very fentanyl or opiate naive, meaning that if you've never had it, you don't know how your body is going to respond. Fentanyl is a narcotic that is used for pain management in hospitals and in the pre-hospital setting. The issue with street fentanyl is that it's laced with a whole bunch of other stuff. And so the majority of overdoses actually happen not just with pure fentanyl, but with fentanyl laced with other things, because it enhances the effect of it and it makes it cheaper for people to make on the road. So fentanyl alone is not necessarily the problem, and the majority of overdoses don't actually happen in hospital or by people using it who have been given it by their doctors or prescribed for reasons, but rather outside of where it is supposed to be used. The intravenous dose to kill 50% of naive opioid users, which is called your LD50, is at 2 milligrams of fentanyl. And the issue is that you don't know how naive to fentanyl you are if you've never had it. In the same way that you can have someone who can have one glass of wine and they feel nothing, and you can have someone else who has one glass of wine and they're tipsy, borderline drunk. Drugs affect people differently, depending on your weight, depending on age, depending on your gender, depending on how often you've had it. If there's down regulation or up regulation, these things affect the way the drug affects you. So how do we combat what is the problem with fentanyl? So fentanyl drops your breathing, because it calms your whole brain down. Your breathing center in your brain also calms down, and your breathing goes from normal to less to none. With fentanyl, you can get something called wooden chest syndrome. And so what happens is that with a large dose of fentanyl given quite rapidly, it can cause your chest to go wooden, meaning solid, and you cannot breathe. You give it the dose, your breathing stops, and you die. And that is an issue with fentanyl, is that it's so strong and so potent that just a little bit of too much of it can be the difference between life and death. And so the reason this is a problem is that it's widely spread and used all over the place. So what can we do about someone who has taken a overdose of fentanyl, or someone who has just taken a overdose of something, we don't know what it is? We're going to look out for what signs and symptoms they're presenting. Do we have an upper or a downer? Sometimes they can be mixed. So an upper would refer to someone who takes a drug and their heart rate increases, they become more vigilant, their pupils dilate, and they become more awake and potentially happier or more excited. A downer, like fentanyl or heroin, causes a pinpoint pupil, so your pupils will constrict, your breathing will slow. What can you do for someone who you think has taken an overdose and you think it's a downer? Well, there's a good chance that there's probably some sort of fentanyl involved in there, or some sort of opiate or synthetic opiate, and that is what's causing the downing effect. Well, you can give them Narcan or Naloxone, so that's going to reverse the opiate. So I think general dose is like 0.4 to 1 milligram. This can be given IV or into the muscle IM, or even into the nose intranasal. First responders can buy this and can administer this. It's becoming more and more available to try and avoid these issues. Similar to an EpiPen, you can have a Narcan or a Naloxone pen. You stick it into the muscle and it reverses the effect of the drug. An issue with Narcan is that it doesn't have a very long half-life, meaning it doesn't work for a long time. So sometimes the fentanyl or the heroin has a longer lifespan than the naloxone, so you're not just safe once you've had the naloxone, you still need to see a medical professional. Morphine and fentanyl don't actually take away pain. All they do is they increase your threshold towards pain. A way that I've seen it, and I've had patients with opiate overdoses, or I go to a clinic where they have administered too much morphine and the patient's breathing has decreased. You can provide them with a painful stimulus, So there's many ethical and unethical ways that this is done. So you could, pinch them on their nail, or you could pinch them on their shoulder, or you could give them a sternal rub, or inflict pain on the person. And this pain will actually increase their respiration rate. So I have seen people do this where they have administered too much, let's say, morphine to their patient, and now the patient falls asleep and becomes unconscious and stops breathing. If you give them a painful stimulus, they actually start to wake up. One way to deal with this, if you don't have Narcan, is to just provide a painful stimulus. They're probably going to wake up. The issue, obviously, is that with fentanyl, it's so strong and you don't know what other medications are in it, because it's probably laced with something else to make it more potent. This may or may not work, but it is definitely worth trying. The painful stimulus sector of the brain is much stronger than the sleeping sector of the brain. It's the same reason why you can't sleep in pain. So if you provide a painful stimulus to someone who has had fentanyl or heroin or some sort of synthetic opiate, they start to breathe. I have seen this firsthand. So I hope that helps someone. Guys, if you found this educational, if you found this helpful, please share this with the world, put it on Facebook, hit like and subscribe, and leave a comment below. This helps the algorithm push this out to more people. I'm hoping that we can have less people die every 5 minutes.